Members, next we're going to go to a presentation of the department's special education statewide average expenditure. And again, a report was recently released. And you also have a folder with information in it. And again, I could call your attention to a 2013 Office of the Legislative Report on Special Education if you want to dig in deeper to information that the audit report reveals, some of which we've worked on in this legislature. Welcome, Dr. Melcher.
Madam Chair and members, my name is Tom Melcher. I'm the Director of the School Finance Division at the Department of Education. Also with me is Paul Farron. Paul is the supervisor of our special education funding and data team, and he did most of the detail work on this report. And if you have questions that go into the special education programs, we also have Robin Widley and others here who could help answer those questions. The requirement for this report was established by the 2013 legislature when the legislature changed the funding mechanism for special education. Traditionally, Minnesota has funded special education cost on a straight reimbursement type model where we fund a percentage of the salaries and other expenses for special education. In 2013, the legislature decided to add a component to the funding formula based on a student-based approach to funding. We still primarily fund based on a reimbursement basis, but we do now include a portion of the formula that's based on the cost per special education student. And so when that was enacted, it was felt that it was important for us to keep tabs on where we're at in terms of the cost per student by disability area as general information to the legislature, and also to provide a sense of whether we're on track in terms of the funding that we're allocating on that basis. So I apologize, I don't have a PowerPoint prepared for this. Unfortunately, the kind of data I have is all like small numbers, and so it didn't seem to fit well with the PowerPoint. So I'm assuming that you have a copy of the report, and I'm going to walk you through some of the pages there. So on page...
You have the report.
So, Madam Chair and members, starting on the bottom of page 4, we have a listing of the primary disabilities for special education. When school districts report their data on special education to the department, the expenditures are broken down by primary disability areas. And we have information reported on our UFARS, Uniform Financial Accounting and Reporting System, that identifies what the expenditures are for each disability area. And we also have data coming in through our MARS system, which is our student accounting system, to identify how many students are being served in each disability area. So we have pretty good information on how many students are served in each area and what the cost is that's reported for those areas. What the new funding formula does that takes effect in the 2015-2016 school year, so we've just finished the first year and we're into the middle of the second year now, it rank orders the different primary disability areas in terms of the cost per student, and it provides more funding for disability areas that have higher cost per pupil on the average. So if you turn to page 7 of the report, there's a little summary chart, and what this does is it identifies the number of students, the 2016 child count in each disability area. And I apologize, we didn't have room on the page so you have to kind of flip back to the previous page to see what the category is. So for example, disability area 403 is developmental cognitive disabilities, severe or profound. That's the most expensive area. On a per child basis, there were 1,997 students counted on the December 1st, 2015 count. School districts reported $96 million in cost for those categories. In addition to the cost that's reported directly in individual special education categories, we also have a UFARS code. It's code 420. You see it at the bottom of the table. There was $292 million reported in kind of district-wide costs, and those are costs for programs that serve students with 3 or more primary disabilities. So for example, that's where the special education director's costs would be, other costs that need to be spread across categories. So in order to estimate the cost of serving students with disabilities, we take the cost that's directly charged. That would be, for example, for teachers that are working specifically with that disability. And then we add this allocated cost. So for this particular category, we had $96 million of direct cost, and then $4 million that was allocated for indirect costs that couldn't be directly charged to a disability. And when you divide that by the number of students, you come up with an average cost statewide of about $50,624 per student for that particular category. And so we do the same sort of calculation for each primary disability area and come up with an average cost for each of those areas. So the highest was the developmental cognitive disabilities, severe or profound. The very lowest at the bottom of the table, 410, is other health disabilities, and the average cost per student for that category was $6,436. Part of the reason for doing this cost report annually is that when we went to a student-driven funding formula in part, we had been collecting this data for quite a few years, but we had never used it in the funding process. So there was an expectation that when districts realize we're using it for funding, they're going to be a little bit more careful in how they account for the cost and make sure they get it in the right bucket, and the legislature might want to come back at some point and readjust, which categories are considered high cost versus moderate cost versus lower cost categories. So the way that the original legislation was structured, if you actually turn back to page 5, you'll see the statute that refers to this program. And it might be easiest if we start at the bottom of the page there, and you'll see that what the formula does is it funds programs that are in the highest cost category at $27,000 per child per year, and that includes the developmental cognitive mild moderate, developmental cognitive severe profound, physically impaired, visually impaired, and deaf blind. Those were the categories that had the highest average cost per student in 2013 when the formula was established, and so they were lumped into this category. We calculated this average cost per student. The next category down was funded at $18,000, and that was primary disability areas of deaf and hard of hearing and emotional or behavioral disorders. And then the next category down was autism, spectrum disorders, developmental delay, and severely multiply impaired. So those 3 groups all have a certain rate per child count. And then what the legislation also did is it took the other lower cost categories, for example, speech impaired and other health disabilities, and instead of funding those on a direct rate per child, what the legislature did was establish a funding formula that's based on the total number of students in the district. And so what the funding how that funding works is we provide $450 per average daily membership for all of the students in the district, plus $400 times the percentage of students that are free and reduced lunch. So if 50% of the students were free and reduced lunch, the district would get another $200. And it's been documented that we have higher concentrations of special education students in high poverty areas. And then the third one is there's a small factor applied to the overall district size. And this part of the formula is very similar to the federal formula for special education, where most of the money for federal funding goes out based on the total enrollment in the state and in the school district. And also there's a factor for poverty. The federal government switched back around 18 years ago to what we call a census-based formula. It's more consistent with what we do in the general education program, for example, where we fund based on the number of students in the district. So at this point in time, what we've done is we've taken the cost by disability And then on page 8, we summarize that down into these 4 funding levels that were established in the law. And what we're doing with the report is trying to gauge whether, are we still on track in terms of, is the funding formula reflecting what the differences are in the average cost. So over on the left-hand column here, you can see funding levels 1 through 4, with level 1 being the lowest cost on the average and level 4 being the highest cost. So you can see the average funding amount by category, and then over on the right-hand side, you can see the average cost by funding category. And as you can see, there's still a pretty good correlation between the average cost by funding category and the average funding level. But there are some adjustments that could be made to better align the funding rates with the average costs by category. For example, you can see that after we work through that pupil-driven formula, that the average funding amount is about $8,200, the average cost is about $8,600. So we're a little bit low in that area. The same at level 2 is especially low, 10,000 versus 13,000. And then we're much closer for levels 3 and 4. And so what Table 4 does is it offers some suggestions to the legislature on how those statutory factors could be amended to reflect the most current data. And it suggests that the rate that is currently set at 10,400, if you wanted to reflect the most current data, we would be adjusting that to 12,700. The 18,000 would be adjusted to 19,000, and the 27,000 would be adjusted to 27,200. So there are some adjustments that could be made if we wanted to better align the funding with the cost levels. And the same would be true of these per pupil amounts. So for example, the 450 would be adjusted to 467. So this is just provided in the interest of keeping you up to date on how the cost of special education is comparing with the amounts that were set in law a couple of years ago. One thing I will say is that part of the governor's recommendation for special education funding does pick up the changes that are included in this report. It would increase the cost of special education aid by roughly $2 million a year if these kinds of adjustments were made in the funding mechanism. So that's a very quick run-through, Madam Chair, and Mr. Farron is here and is able to answer any more detailed questions that you might have, or if you have questions about some of the disability areas and want to have further information on those and why the costs might be varying, either Mr. Farron or Robin Woodley from our special education department could respond to that.
Thank you, Mr. Melcher. And on page 9 is the proposed language that the commissioner will bring forward. Is that correct?
Madam Chair and members, yes, that will be included in the governor's bill.
Very good. Thank you. Representative Erdahl has a question.
Thank you, Madam Chair, and all of this is for Dr. Melcher or Mr. Perrin. Of the dollars spent for special education in Minnesota, do you know what percent comes from the federal government?
Madam Chair and Representative Erdahl, that reminds me that there was another document that was
Yes.
included in your packet that is not part of this report, but it's a separate report, and I think members should have a copy of that. So currently, and this report just shows the Part B Section 611 funding, which is the primary federal special education aid that flows out to school districts. We're currently receiving about $194 million. The cost of special education is roughly, I think, around $2.4 billion. So the federal contribution is relatively small. And just to give you a little history about this report, back in the mid-'70s, when the federal government created the federal mandate for special education, wrote the federal special education law, the goal for federal funding at the time was to cover 40% of the nationwide average excess cost for special education. And we've kept track of that over the years. The federal government has never come anywhere close to the 40% level. And so for the current year, 16-17, if we were to receive the funding at the 40% level, it would be about $606 million. We're currently receiving $193 million, so they're covering about 13% of the average level, which is lower than the Minnesota level. So currently, the federal government, by our calculations, is about $412 million short of funding what their goal was from the 70s.
Okay, thank you.
Dr. Melcher, Mr. Heller has a question in regard to the funding code. Where would we find the twice exceptional listed in the, or Mr. Farron, maybe you can answer that?
Madam Chair, I guess I don't understand what twice exceptional,
The print disabled.
I'm sorry, what?
The print disabled.
Print is it?
120B.15 is the statute he references.
when-
We're going to bring Ms. Widley up.
Madam
Welcome,
Chair-
please say your name for the record.
Madam Chair, members of the committee, my name is Robin Widley, and I'm the Director of Special Education at the Department of Education. As I understand, twice exceptional is an area where a child may be disabled as well as be academically gifted. And within that, I'm not aware that we have any categories that are in this funding formula.
Thank you, and perhaps Mr. Heller could address you with that question. Thank you
Thank you very much.
Representative May-Quade, did you have a question?
Thank you, Madam Chair. This might be to the folks up here, but it actually might be to the chair. Have we ever lobbied our members of Congress or the federal government to get our funding for special education? This is something I do hear a lot about in the district, and particularly from G&T and special ed parents feel like their children are being pitted against each other. Have we ever coordinated like a 50-state strategy to get our funding? I'm not sure what has been done in the past.
Well, when Representative May-Quade, when Representative Klein was chair of Labor and Education, he heard from me probably every other week. So I'm sure if he heard from me, he was hearing from other members too, pleading that the federal government consider increasing its full funding level closer to 40% than it presently is. Thank you to both of you. Dr. Melcher or Mr. Farron maybe could answer this. I was reading the litigation report that I just received, noting that we had some high litigation costs. Maybe this is not unusual. $273,952.23 were litigation costs. Could you just comment on that report, or whoever could just comment on that report? Just whether or not this is usual or was this exceptional. Please say your name for the record.
Good morning. My name is Mary Kay Kanega-Litza. I'm the Director of Compliance and Assistance.
Welcome.
Thank you. Madam Chair, I can speak in general as to what the
Certainly.
types of litigation costs that we have. Litigation costs can be included with, there have been some lawsuits, and so regarding different areas, and if they have a piece of special education, that would be covered. If we have a complaint that is appealed to the Court of Appeals, if there is a due process hearing and we need to have the Attorney General do some work on that regarding appeal as well. We had some student maltreatment issues as well, and if they involve a student with a disability, that would also be involved in the litigation costs.
Thank you very much for that clarification. Members, you might want to go to the website of the department if you've not received this special education litigation costs for fiscal 2017 and just review that, because it also tells us that that is another area for which we provide funding. Dr. Melcher.
Madam Chair, if I could just add one comment. I think Ms. Litzow was referring to some of the litigation costs that the department is involved with, and that the report I think that you are referring to is a report from the school districts that are required to
You're correct.
annually report to the department on litigation costs that they incur as school districts. over the similar kinds of issues.
So Dr. Melcher, is there a separate place where the department indicates what it's cost the department?
Madam Chair, the report that we produce to the legislature annually is a report from the school districts, what their expenditures are, and we pull that from the UFAR's reporting, and I don't know, you may want to, there are some costs the department may have involved as well. With
Okay,
returning.
thank you. Welcome. Say your name for the record.
Madam Chair, Darren Cordy, I'm an Assistant Commissioner at the Department of Education. First, just like to say I'm happy to be back in front of your committee, Madam Chair. We do track those expenditures. It's not something that is included in a report to the legislature, but certainly if that was something that the legislature was interested in taking a look at, that's all public data that can be provided to you.
Thank you very much. Representative Pryor.
Thank you, Madam Chair. I think you indicated before that maybe you could speak a little bit more about what might be driving these costs to increase more in an unexpected way, especially relative to other, within the categories, how some costs seem to be rising faster than others or more than others. Is that the case?
Mr. Farron.
Thank you, Madam Chair, Representative. Districts basically, so theirs is, they're going to report costs in we have an electronic data reporting system. That's where we're going to further request them to report their costs. So not only is it sitting in their UFARs, financial actual accounting, which is tied to their checkbook, they have to report to us in our electronic data reporting system, EDRS. This allows us, they have to specifically give us the actual teacher's or the service provider's name along with the file folder number, which we can then tie back to verify their license to that disability. A problem that I know we generally have with some of the lower, with specifically the traumatic brain injury being one of the lower of the average costs, is there is no specific license there. And so districts on average seem to they don't report costs there. And instead, the students are receiving services from other licensed areas, the speech pathologists and just other physically impaired and other groups. But they're reporting the cost of that individual solely based on just their license. We do a lot of training and instructing, and we provide reports showing what their unreimbursed rates are for tuition billing to then help them to, you have students you're reporting here, they are, specifically with these traumatic brain or the deaf-blind, and the instructions are generally, look to see who your students are in the districts. Most have, fewer than a handful at best, or even with the deaf-blind, maybe just one at best. And seeing then who does work with that student and then making sure that they're allocating part of their salary to that disability.
Welcome. Say your name again, and would you spell?
Yes, I will, Madam Chair. My name is Robin Widley, R-O-B-Y-N, and W-I-D-L-E-Y. And once again, I'm the Director of Special Education at the department. As I was looking at a couple pieces of data that Tom Melcher just gave me, as we think about a couple of the categories, especially in the area of developmentally delayed, which is a category for children ages 3 through 7 who are disabled, that number has really increased due to the significant efforts of local districts and their county agencies in terms of identifying kids who have special needs. So we're real proud of that. And in addition, there's another category that's increased that has some cost factor to it, and that would be kids that are severely multiply impaired, meaning having more than one disability, and those children generally have some high costs in terms of services. I also would say to the committee that we do have an increase in children in our child count that we take every year for kids that are on IEPs, ages birth to 21. Once again, we are a state that provides special education down to birth. We're one of the few states in the country that does that. And our current numbers of children ages birth to 21 who are on IEPs and receiving special education in our state is 137,601. Which is 15.7% of the population of kids who are enrolled in school. And of that, children ages 6 through 21 represent 13.5% of the population of students who are receiving special education in comparison to their general education peers. So that gives a little bit of a context, if you will, for the numbers.
Thank you very much. And thank you, Dr. Melcher, Mr. Farren, and everyone who's assisted in this presentation on special education. Very much appreciated.